Hi everyone, we're going to look at chapter 20, Enteral Nutrition, the use of feeding tubes or intravenous infusions. Okay, so enteral nutrition, number one, uses the gastrointestinal tract. It's known as tube feeding, and it is preferred to parenteral nutrition if the GI tract is functioning. Okay, so let's talk a little bit about oral supplements because that fits into this category as well. It may be easier to consume than a meal. So examples would be nutrient-dense milkshakes that you can make, fruit drinks, puddings, or snack bars. Taste is an important consideration. So these kinds of oral supplements may taste better cold. And the popular list of supplements sold in the stores are going to be Ensure, Boost, and Carnation Instant Breakfast. Okay, and they may be specific for disease state. So there may be something for diabetes called Glucerna, or if you have renal diseases, you would be taking something called Nepro. And we'll talk about that actually in just a little bit. Okay, so tube feeding delivers the formula directly to the GI tract. Okay, candidates for this would be people with swallowing disorders, impaired motility of the upper GI tract, GI obstructions, and fistulas that can be bypassed by a feeding tube, intestinal surgeries, mechanical ventilation, and mental incapacitation, little or no appetite leading to malnourishment, extremely high nutrient requirements. On the other hand, it's contraindicated for people with severe GI bleeding, high output fistulas that a feeding tube cannot get around, intractable vomiting or diarrhea, you can't have a tube near that, severe malabsorption, when the need for nutrients is less than 5 to 6 days if someone is malnourished, and less than 7 to 9 days if they are actually adequately nourished but just in need of more nutrients. Okay, so gastrointestinal access, we have a very good chart right here. Chosen when the duration of less than 4 weeks is expected, okay, and that's going to be transnasal. It's going to be right through the nose. Anerostomy, it's a direct route to the stomach, so it's actually an opening in the abdominal wall, and you can see it, it's going to be here. It's either a gastrostomy or a jejunostomy, okay? It's selected when the duration is less than 4 weeks. Okay, so gastric feedings are avoided in patients with obviously high risk of aspiration, right? Because we do not want the contents of the stomach entering into the lungs at any time. Feeding tubes are often soft and flexible, right? Silicone, polyurethane, polyvinyl. They come in various lengths and diameters. They're measured by French units. The choice is based on patient age and size and formula viscosity. We want actually the smallest diameter tube that can be used to push the formula through. Okay, so here is the another chart, a really good chart on tube routes. Okay, so enteral formulas, they're going to be broken down as shown here. So standard formulas are polymeric, okay? So they're when the nutrients can just be digested and absorbed without any kind of difficulty, okay? Elemental formulas are hydrolyzed, okay? That's when the patient has a compromised digestive absorption going on. So proteins and carbs are all broken down. May provide fat from medium chain triglycerides, which is very easily absorbable in the body. There are specialized formulas. They tend to be expensive and controversial. These are the ones that are disease specific, and the reason why they're controversial is that they're finding that standard formulas can usually do the job. Like, let's say you wanted a Glucerna for someone who's diabetic, Well, the standard formula, yes, is going to have more sugar, but the outcomes may not be all that different for the patients in terms of hyperglycemia. So there's a lot of studies done on that, and it's still out there. And then modular formulas, that's if you want to provide certain nutrient combinations in addition to what's already provided. There are actually more than 75 enteral formulas on the market right now. And here's sort of like just a look at it. Okay, so the formula characteristics obviously are going to vary in nutrient and energy densities. Okay, and that could be one way that you would determine what's going to be used. The protein content is going to be 12 to 20% of the total calories. We know we're going to restrict that for people with kidney disease who are not being dialyzed. The energy comes from 15 to 30% fat and 30 to 60% carbohydrate. Energy density is going to be 1 to 2 kcals per milliliter of fluid. Okay. And there's actually going to be a little diagram of how that works. Okay. Formula characteristics. Fiber content, it may be helpful for improving fecal bulk. Okay, so if there's constipation, diarrhea, or maintaining blood glucose, may not be a good idea for somebody who has acute intestinal distress, pancreatitis, or if they are before or after intestinal exams or surgeries. Osmolarity. The only thing you really need to know about this is that when the osmolarity is similar to blood serum, it's called isotonic. And when it's greater than blood serum, it's called hypertonic. Okay? So if they are administering medications into the formula as well, it could increase the osmotic load and possibly lead to diarrhea, which would not be good. Next, let's look at selecting formulas. So we are going to be looking at it, and depending on the manufacturer of the formula, all of this is going to be provided to you in like a booklet. I'll try to remember to bring mine in. And it breaks it down by nutrient and energy needs, fluid requirements, need for fiber modifications, whether a patient has any kind of food allergies or sensitivities, and what's available. So usually what happens in a hospital or clinic, they're going to go with a manufacturer. So they're either going to go with Nestle is one major manufacturer of formulas, or they're going to go with Abbott. There usually isn't too much of a mixture of the two, but there might be. But what you will get from when you start your job working in a hospital is you will actually get a printout telling you what formulas are available. Why is this important? Because the booklets that come with it, you're going to determine the energy needs for your patient. That is, first and foremost. Then you're going to go through and find a formula that's going to meet those needs. That's how that works.